Here's my audience of 7 people at the library. Hello everyone, my name is Kyra Ramos and I'd like to tell you a little bit about post-traumatic stress disorder. Now, when I mention trauma or PTSD, what do most people think of? A lot of people would think of veterans and coming home from war and the traumas that they experienced overseas. The American Psychological Association actually defines trauma as an emotional response to a terrible event like an accident, rape, or natural disaster. So oftentimes after somebody experiences a trauma like this, they'll develop post-traumatic stress disorder. And it can come from various different triggers. It manifests in many different ways, and it can be pretty challenging to treat. So now that we've defined what trauma is, it's pretty simple to come up with a list of different types of people who could experience PTSD. Anyone who's been in an automobile accident, has experienced sexual or physical assault or abuse, been threatened with a deadly weapon, had a serious injury, near-death experience, victims of natural disasters, terrorist attacks, and mass shootings. The important thing to remember is that even witnessing one of these events could potentially lead to PTSD. You really don't even have to experience it firsthand. So these are some pictures of different types of people who could experience PTSD. So just like there are different sources of PTSD, the manifestations can also vary from individual to individual. And while it is normal for people to have trouble adjusting after a traumatic event, it's when the symptoms last for a really long time and they interfere with your daily living that it really becomes a problem. And the Mayo Clinic has come up with a list of 3 different categories of the symptoms of PTSD. They include intrusive memories, avoidance, and changes in emotional responses. Intrusive memories are basically just recurrent distressing memories of the event. They could come in the form of flashbacks where you feel like you're really there again. Some people have nightmares or terrifying dreams. Avoidance is just when people choose not to talk about it. They may avoid situations or events that remind them of the event. There are also changes in emotional reactions. Somebody who was previously even-tempered may become angry, irritable, or aggressive. There may be trouble concentrating or sleeping. They may be easily startled or feel like they need to always be on guard to protect themselves. This could also lead to self-destructive behavior, like abusing drugs and alcohol. And the intensity can change from time to time. It can become worse in times of emotional stress, get better from times. So as you can see, with all the different symptoms of PTSD, it can be pretty challenging to treat. Because of the anxiety that's involved in the disorder, traditional psychotherapy is very challenging. So what has shown a lot of promise recently is prolonged exposure therapy, or forced exposure therapy, more commonly known as. And what this does is it helps you safely face what you find frightening, so that over time you can kind of learn to cope with it in a more appropriate fashion. In the case of someone who was raped, they may take them back to the rape scene to try to dilute the anxiety involved. In the case of soldiers, a lot of times what they'll do is hook them up with virtual reality to kind of take them back to that place and face that event. There was a 2013 study done by the University of Pennsylvania, and they found that there was a 42% reduction in overall symptoms when they exposed veterans with PTSD to prolonged exposure therapy. Medications are also sometimes used in the combination with therapy. Your antidepressants like Paxil, Prozac, and so forth, they will take care of some of the anxiety and depression that is associated with PTSD. Some of the more severe cases may require anti-anxiety medications, which are usually your benzodiazepines, Xanax, Valium. The problem with these is they're really not a long-term solution. They can lead to addiction. They're very highly addictive substances, so they're not appropriate for long-term use. Well, thank you for listening, everybody. I hope you were able to learn a little bit about the causes, symptoms, and treatment of PTSD. Thank you.